Delhi has logged 3,194 new COVID cases over the last 24 hours. That's 15% higher than yesterday. Remember, the city logged 2,176 cases on New Year's Day. That was a 50% spike. The positivity rate in the national capital has also risen to 4.59%. This is according to data from the city's health department. Today's figure is the highest daily surge since the 22nd of May. New Delhi has also reported the second highest cases of the highly transmissible Omicron strain after Maharashtra. The number of active coronavirus patients in the capital now stands at 8,327. That's the highest in about 7 months. Still, the Delhi Chief Minister Arvind Kejriwal says that there's no need to panic yet, because though the number of cases are rising rapidly, the number of hospitalizations are not. And in fact, he says the impact of the virus in this phase is far lesser than what it was during the second wave.
केसेस तो बढ़ रहे हैं, लेकिन चिंता की कोई बात नहीं है, पैनिक होने की कोई बात नहीं है। सबको जिम्मेदारी से काम लेना है, लेकिन पैनिक होने की कोई बात नहीं। और आज जो शाम को रिपोर्ट आएगी उसमें लगभग 3100 के केस, आज की डेट में 6,360 एक्टिव केसेस हैं, 6,360 मरीज हैं। 3 दिन बाद 1 जनवरी को 247 लोग एडमिट थे, थोड़े कम ही हो गए। इसका मतलब क्या हुआ? इसका मतलब ये हुआ कि जो लोग कोरोना से बीमार हो रहे हैं उन लोगों को लगभग किसी को भी अस्पताल जाने की जरूरत नहीं पड़ रही। सब लोग माइल्ड केसेस हैं, छोटा मोटा खांसी बुखार, बिल्कुल माइल्ड केसेस है या एसिम्प्टोमेटिक केसेस।
All right, let's go across to Akshay Dongre, who's monitoring the situation in the national capital. Akshay, we heard the Chief Minister there. He presented data to show that despite an increase in COVID-19 cases, bed occupancy in hospitals in the national capital is less than 1%. Of course, very low compared to the same time last year during that deadly second wave of the coronavirus in April. However, at the same time, Akshay, we're hearing the Delhi Chief Minister cautioning people not to drop their guard. What is one supposed to take away from all of this today?
Well, Sarah, certain things are very clear by now, that the number of cases in the national capital are rising at a very rapid pace. Now, the Delhi Health Minister himself, around a week back, had said that approximately 50% of the cases that are being tested for genome sequence, that are being genome sequenced from the community, now they are being tested positive for Omicron variant, which means that the highly transmissible variant is now spreading in the community as well. As far as the rise in the number of cases are concerned, while the Chief Minister is cautioning people, he's also saying that there is no need to panic, and that's solely based on the fact that the hospitalization remains low so far. However, there is a catch to that. We have seen in the earlier waves as well that when the number of cases start to rise and at a rapid pace, the hospitalization follows that same pace, but at a gap of about 8 to 10 days. So if we see that what exactly was the number approximately 10 days back or 12 days back, then on 21st of December, the positivity rate was just 0.2%. The number of cases were 104, but now the number of cases are approximately 3,200 and the positivity is almost at 4.6%. If we go according to the earlier plan, that was the graded response action plan, according to that, if the positivity rate is somewhere close to 5% or above 5% for 2 consecutive days, it means a red alert, which is the highest level of preparedness by the Delhi government, and the restrictions are extremely high. However, in Delhi, yellow alert is continuing, and that is solely because if the government goes on with more restrictions, if they shut down industries, if they shut down the construction work that is going on, then a lot of migrant laborers who are in the national capital, they again are without a job. Then there might be a situation that they will think about moving back to their villages, something that we saw during the first lockdown, that there was a huge migrant exodus, and that also led to a transmission among the laborers who were in fact going packed in buses, and they in fact even started walking back home. So now the situation is extremely complicated. So the government is now going according to the hospital admissions. So till the time the hospitalization remains low, there won't be new curbs, neither the amber list nor orange nor the red list. So remains to be seen that what exactly is the hospitalization in the next coming days. But the situation needs to be monitored extremely carefully because the situation is still developing, and any kind of data or scientific evidence can only come after the doctors, the healthcare experts, in fact, monitor the situation for around 2 weeks. So it's too early to say anything, but no fresh curves will be taking place in Delhi, despite the positivity rate shooting up to an all-time high if we look at 6 to 7 months back, and it's almost coming to a level where we saw devastating number of cases, hospitalizations and oxygen shortages in the national capital. So according to the doctors, now the situation is to be extremely cautious and everyone needs to keep their guards up.